Today we're looking at something I think a lot of people are curious about, laser hair removal.
Mm-hmm.
We're going to break down how it works, what the process looks like, and ultimately, based on what we know from the Mayo Clinic, whether it's a good option for you.
And the science behind it is really interesting. I think you'll find, we're basically talking about using light beams to disable hair follicles.
Okay.
We'll also get into things like the safety, a little bit of the history,
Oh.
and even touch on some really exciting cutting-edge developments.
So how does this work? I mean, people who are new to this, is it as simple as like zapping away hairs with this laser beam?
Well, in a way, yeah, but it's more nuanced than that.
Okay.
You're on the right track, though.
Okay.
It boils down to this principle called selective photothermolysis.
Okay.
Now, just picture this. Think of like you're shining a flashlight on a dark object in a bright room. The light's naturally drawn to the dark object. So, similarly, in laser hair removal, the laser is attracted to the pigment or the melanin in your hair.
Okay.
So this laser emits light energy, which is then converted into heat.
Uh-huh.
And this heat ultimately damages those hair follicles, which are those tiny sacs in your skin responsible for hair growth.
So it's not like burning the hair off, you're actually targeting the root of the problem.
Exactly. And that selective part of the process, that's super important.
Yeah.
You see, the laser is designed specifically to go after that darker pigment in your hair without harming the surrounding skin.
Makes sense.
And this is precisely why, as the Mayo Clinic points out, the effectiveness of the treatment is very much dependent on the contrast between your skin and your hair color.
So if you have like really light skin and dark hair, you're going to see more dramatic results than, say, someone with like blonde hair and fair skin.
Exactly. That contrast allows the laser to really zero in on that hair pigment.
Okay.
But wait, for those with darker skin tones, there's good news. You see, there have been incredible advancements in laser tech that are making this procedure a possibility for, a wider range of people.
That's great.
Than ever before.
Yeah. So what about those with lighter hair colors?
Yeah.
Like blonde, red, gray, white hair.
Yeah, so that's where it gets a little tricky.
Okay.
You see, those lighter colors, they don't absorb the laser's light as efficiently.
Okay.
But research is ongoing, and new technologies are always being developed.
Okay.
Right?
So maybe someday it'll be an option for everyone, regardless of their natural hair color.
Exactly.
That's exciting to think about.
Yeah.
Now, one thing I think is important to clear up, and the Mayo Clinic makes this point, we often hear this term permanent hair removal.
Right.
But it sounds like it's not as simple as that.
You're right.
Yeah.
So laser hair removal can significantly reduce hair growth.
Okay.
And for some, it may even feel permanent. It's usually more accurate to think of it as, long-term hair reduction. It's not just a one-and-done deal.
So what does that mean in terms of treatments?
You'll likely need multiple treatments spaced out over, weeks or even months.
Okay.
And think about it this way. Not all of your hair is actively growing at the same time.
Right.
You see, hair follicles, they go through different cycles.
Mm-hmm.
The laser is most effective when it's targeting the follicles that are in that active growth phase.
Got it.
So multiple sessions are needed to catch all those hairs at the right time.
It's like whack-a-mole with your hair follicles.
Yeah.
Okay.
You got it.
And even after those initial treatments, you might need like occasional touch-ups down the line.
You might.
It just depends.
It really depends on, individual factors
Right.
like hair type, hormones, things like that.
All right, so someone's listening to this right now, and they're thinking, okay, this sounds promising. Maybe this is something I should look into. What are some things they should consider before they really take the plunge?
That's a great question. And the Mayo Clinic offers some good advice here. So first off, as we just discussed, your skin and hair type are really important.
Right.
And then, think about the specific area you're interested in treating.
Okay.
You see, laser hair removal is really versatile, and you can use it on most areas of your body.
Okay, except for a few sensitive areas, right?
Yeah, exactly. The Mayo Clinic specifically advises against treating the eyelids or the area surrounding the eyes.
Okay.
Or any skin with tattoos.
Got it. So no laser beams near your eyeballs.
Yeah, exactly.
Okay.
And this might seem obvious, but it's important to consult with a qualified healthcare professional,
Okay.
like a dermatologist or a cosmetic surgeon,
Okay.
to really understand the potential risks and benefits for your specific situation. They can assess your skin type, your medical history, and answer any questions you might have.
You really can't overemphasize finding a qualified provider.
Absolutely not.
Okay, so what can you actually expect when you go in for one of these treatments?
Yeah, a lot of people They're a little intimidated by the whole thing.
Yeah.
But, think of it more like a medical procedure than a spa day.
Okay.
Okay, so first, you'll be wearing special goggles
Okay.
to protect your eyes from the laser.
Hmm.
And the doctor may apply a topical anesthetic to the area being treated.
So you're numbed before they even begin.
Exactly. That helps minimize any discomfort during the procedure.
Okay.
Then they'll use this handheld laser instrument to target those hair follicles.
Okay.
And the sensation can vary, but many people describe it as, like a warm pinprick or a rubber band snapping against the skin.
And do they do anything to help with that discomfort?
Oh, yeah. Many clinics use cooling devices or special gels,
Okay.
to help minimize any discomfort and protect your skin during the treatment.
Okay, so it might not be completely pain-free,
Right.
but it sounds manageable.
It is.
And what about afterward? What kind of recovery time are we talking?
Well, the good news is there's usually minimal downtime. Yeah, you might experience some redness and swelling in the treated area for a few hours.
Okay.
But this typically subsides pretty quickly.
Okay,
And applying ice to the area can help soothe it.
makes sense.
And it's really important to avoid sun exposure and tanning beds for a few weeks after the treatment to protect your skin.
Makes perfect sense.
It does.
Now, the Mayo Clinic really emphasizes choosing a qualified and experienced provider
Right.
for this procedure. And they explicitly advise against going to spas or salons for laser hair removal.
They do.
Why is that?
Well, it all comes down to training, expertise, and the potential for complications if the procedure isn't performed correctly.
Right.
You want someone who's board certified, experienced with laser technology,
Mhm.
and knowledgeable about different skin types.
Yeah,
You really don't want to cut corners when it comes to your health and safety.
absolutely. And even with a qualified professional, there are still potential side effects, right?
That's right.
Yeah.
The most common ones are usually temporary and include things like, skin irritation, redness, swelling.
Right. We talked about that.
Yeah, we touched on that.
Yeah.
And these typically resolve on their own within a few hours or days.
Okay.
But the Mayo Clinic also points out that there's a chance of pigment changes
Oh.
in the treated area, meaning your skin might become, temporarily darker or lighter.
And are those changes permanent?
In some rare instances, yes, and the risk is higher for those with darker skin tones,
Okay.
especially if they haven't been careful about sun protection.
Right.
So it's really important to follow your doctor's instructions
Yeah.
carefully, both before and after treatment, to minimize those risks.
What about more serious side effects? Are those a possibility as well?
They are, although they are rare.
Okay.
So more serious side effects like blistering, crusting, scarring, or even changes in skin texture can occur.
Yeah.
Again, this is why that initial consultation with a qualified professional is so important. They can assess your individual risk factors and advise you accordingly.
Okay, so let's talk about those at-home laser hair removal devices
Okay.
that have become pretty popular.
They have?
Are they a good alternative to professional treatments?
That's a question we get a lot.
Yeah.
And, the Mayo Clinic addresses it directly.
Okay.
Their stance is that these home devices might lead to some hair reduction.
Good.
But the key word there is might.
Right.
You see, we just don't have enough research to compare their effectiveness to professional treatments.
Okay.
And there's another important distinction to make.
Okay.
The FDA, they consider these home devices to be cosmetic devices, not medical devices.
Okay.
So this means they don't undergo the same level of scrutiny and testing as the professional laser equipment
Right.
used in a clinical setting.
So kind of a proceed with caution situation.
Yeah, I think that's a good way to put it.
Yeah.
If you are considering an at-home device, it's really important to do your research, understand the potential risks and limitations. And if you have any doubts at all, consult with a dermatologist.
All right. So we've covered a lot.
We have.
How it works, who it might be good for, what to expect during and after treatment, potential risks,
Yeah.
those at-home devices.
Yeah.
So is laser hair removal the right choice for you? I mean, where do we go from here?
Well, for anyone considering laser hair removal, I think it's important to think about this from a personal perspective.
Okay.
There's no right or wrong answer. Each individual has, unique needs and priorities and considerations when it comes to hair removal.
And that's where we're going to pick up in part 2 of this deep dive.
That's right.
We're going to delve deeper into those factors you might want to weigh before making a decision, including, cost, convenience, and those all-important alternatives.
We'll also explore how this decision can be influenced by, societal pressures,
Mm-hmm.
and how to navigate those feelings to make a choice that really aligns with your personal values.
Stay tuned. Welcome back to our deep dive into laser hair removal. In part 1, we really got into the science behind it, those targeted light beams,
Right.
and what a treatment might feel like.
Yeah, and we talked about choosing a qualified provider,
Right.
understanding those potential risks, which is so important, no matter what procedure you're considering.
Absolutely. But let's get practical now.
Oh, okay.
Let's talk cost.
Right.
Laser hair removal, it's not exactly known for being budget-friendly.
That's true. It can be a significant investment.
Yeah.
And it's important to understand that prices, they can vary widely,
Right.
depending on a few things, like the size of the area,
Right.
number of treatments needed, and even the location of the clinic and the provider's experience.
To shop around, compare prices.
Absolutely.
But cost shouldn't be the only factor, right?
No, absolutely not.
Okay.
Remember, you're not just paying for the procedure itself, you're investing in the expertise and safety of that provider.
That's a good point.
Right.
Don't cut corners
Right.
to save money.
Right.
Let's talk about convenience.
Okay.
Multiple treatments spaced out over weeks or even months, that's a commitment.
It is. It is a commitment.
Yeah.
And you need to think about your lifestyle, your schedule.
Yeah.
Can you realistically commit to, these multiple appointments over a period of time?
Factor in that travel time
Exactly.
to and from the clinic,
Yeah.
if you live in a city, especially.
Right. And think about the time for the treatments themselves.
Right.
A small area like your upper lip, that might only take a few minutes.
Yeah.
But larger areas like the back or legs, that could be an hour.
Yeah, an hour or more
Yeah.
per session. So.
If you're someone who's, busy,
Right.
it takes some planning.
It does.
Now, before you commit to laser hair removal, you should probably explore the other options that are out there, right?
Absolutely.
Make an informed decision.
Yeah, there's a whole spectrum of hair removal methods,
Right.
each with their pros and cons.
Yeah. You've got your temporary methods like shaving, waxing,
Yep.
depilatory creams, threading.
Have you ever tried threading?
I have, yeah.
It seems a little intimidating to me.
It can be tricky to find a skilled practitioner,
Yeah.
but when done right, it can be very effective.
Yeah.
And then for those looking for a longer lasting but not necessarily permanent solution, there's electrolysis.
That's where they insert that tiny needle into each hair follicle
That's the one.
and use electric current to destroy it.
Yep, that's it.
Ouch.
It can be effective, but it's time consuming.
Oh,
And let's be real, it can be uncomfortable.
I can imagine.
Yeah,
So weigh those pros and cons of each method. Choose what works for you.
absolutely.
Your pain tolerance, your budget.